Hi, welcome to the MicroMD EMR training for user preferences in the Setup Wizard. MicroMD EMR allows users to set preferences to make using the EMR more efficient. To access the user preferences, you're going to access your Tools menu and go to User Preferences at the bottom of the listing. You'll notice that there are several categories in the User Preference window. The first set of preferences is General. The General Preference category affects general functioning of the application. The first item, Display Welcome Screen at Startup, allows the user to turn on or off the welcome screen. Display New Workflow Order Alerts allows the user to turn on or off the notifications that pop up in the bottom right corner of the screen, similar to those of email. Automatically mark internal mail messages as read when opening allows the user to configure the system to automatically handle that task. Reference List Search Preference. Throughout the MicroMD EMR, you can search through the reference list for data stored in your database. From this user preference drop-down, select how you want to search for this data. Based on the text you type in the search field, the system can find all entries that begin with the first letter you type in, or find all entries that contain the first letter in any part of the description. For example, if you type OMA and you have match only first letters selected, the system will find all entries that begin with OMA. If you chose match any letters in the word, then the system would find all entries with the letters OMA anywhere in the word. This would include descriptions that have two words and the letters OMA appear in the second word. Please note, once you make your selection, should you need to override this while searching, you would simply right-click to override your system setting. Next, Open to Folder. This user preference allows you to define what section of the Template Manager window opens by default. This can be helpful when your practice is storing templates in a shared location rather than a personal. By default, the system is going to access your personal folder. Default Patient Search. Simply select the most appropriate patient search option for your user profile using the drop-down list. Vital signs. You can default a location for taking a patient's temperature, if this is one of the functions that you will be performing in the EMR, and the expert settings. Checking the Remember Choices Made in the Performance status for plans in the encounter. In the Plan and Visit Test sections of an encounter, the system can populate performance status settings to reflect the choices you made in these fields the last time you ordered that same procedure, laboratory test, patient instruction, immunization, referral, or nursing care order. Place a check mark in this box to have the system handle this for you. And finally, electronic signature. Click on this button to enter an electronic signature that will be used throughout the system. The purpose of that field is for physicians and mid-level patient care providers. Other users do not need to create an electronic signature. Let's move to prescriptions. Under prescriptions, the default medication list. From this drop-down, set up the medication list that you want to review when you first open the prescription pad, or any other place where the medication reference list opens. This list includes current medications, past medications, preferred, upcoming refills, and they will appear under the Smart button in the encounter. Next, refill days prior. In this field, you can enter the number of days prior to the end date of a prescription that the medication appears in the upcoming refills list. The next two items, printed prescription form and fax prescription forms, can be created in the EMR Manager and set in this location. If your practice has specific printed and/or fax prescription form needs, we will address those during your implementation. Supervising provider. When you select a provider from this list, that provider's name appears when you use a supervising provider field on a prescription. This is also sent electronically when you send a prescription using SureScripts. Warning level. From this drop-down, you can limit the type of warnings that pop up when you prescribe a medication. The system has a variety of warning types, including severe and potentially severe. If you want to see severe warnings, make the appropriate selection from this drop-down. You should also note that security rights to change warning levels have to be configured by the system administrator to allow you to modify this field. If you are unable to modify this field, that means that you are not given permissions to override the system's warning level configured at the practice. Disable Formulary Details panel. Place a check mark in this box to have the system disable the Formulary Details panel when you're prescribing medications. You do want to make sure, if you are participating in a meaningful use program, that you do not disable your Formulary Details panel, as it is a required option for your EMR in compliance with meaningful use. Printer for prescriptions. This allows you to set a default printer where you can print prescriptions so that the prescriptions are printing on the security paper as necessary. Moving to Session Profile. Session Profile allows you to set a couple of default values for logging into the MicroMD EMR. You can also view your user roles and functions assigned for your user account by the system administrator. First, setting the current location. When you first log into MicroMD, the system will display a welcome window. On this window, you can choose your current practice. If you choose to open the MicroMD straight from your desktop, you still need a way to change your location. You can do this through your user preferences. Transcribe for. If you are a transcriptionist for several people, you can set your default provider and transcription duration here. Click the Transcribe For button to set your default. There are additional details in the user manual on transcribing. Roles and functions. These sections display those user roles and functions assigned to your user account in the security module. If you need additions or changes to your security, you will need to speak with your system administrator. Next is Desktop Navigator. You can customize your desktop by using the Desktop Navigator under Tools and User Preferences. Select the appropriate section from the category drop-down menu and then use the arrows right and left to move items into your selected items list or your available items list. When they're in the available, it simply means they are available for use, but they are not being displayed or they are not selected. You can perform this function for each of the categories that you have assigned based on your user security role. Alternately, you can use the setup icons from the desktop when selected on either of those areas to do the same thing. Encounters. Encounter preferences. In this section of your user profile, you can set user preferences to establish the default values for encounters that you create, including the recording tool you prefer, or template style. MicroMD uses these default settings for the New Encounter window when you click New Encounter task in your chart tools or from your desktop. Starting with the level category, From this section, select the category of encounters you most frequently record for your patients. This sets the value for the encounter level category field on the new encounter window and automatically sets the header when you use My Encounter. Level of encounter. From this drop-down, select the encounter level you most frequently record for your patients. This also sets the value for the encounter level field on the new encounter window and automatically sets the header when you use My New Encounter task. Setting this default can help streamline your billing process and eliminate much of the manual work at the end of an encounter. Examination type. From this drop-down, select the most common type of visit you have with the majority of your patients. This sets the value for the examination type field on the new encounters and automatically sets the header when you use My New Encounter. Recording method. Select the recording tool you prefer to use for the majority of your encounters. The recording tool is the same as the encounter style most frequently used. This sets the value for the recording encounter using the field on the new encounter window and automatically launches this default tool when you use My New Encounter task. It should be noted, if you choose an encounter style that requires a default template, like the Encounter Wizard, you should go ahead and set that as well. The same with the form encounter. This saves your users an extra couple of clicks in selecting the most common encounter type. Encounter duration. Select the amount of time it takes for you to complete a typical visit. This sets the value for the duration field in the new encounter window and automatically sets the header when you use My Encounter task. At any time during the process, this can be overridden by accessing the encounter header and editing the duration field. When opened from desktop. Anytime you create an encounter from the desktop and close it, the system uses this preference to know what you want to see at that time. When you choose Go to Chart, the system opens the Encounter tab of the patient's chart when you choose to close the encounter from the desktop. When you choose Go to Desktop, the system returns to the desktop when you close the encounter from the desktop. Nature of the encounter. From this drop-down, select the most common general category of visit you have with the majority of your patients. This sets the value for the nature of encounter on the new encounter window and automatically sets the header when you use My New Encounter. Patient care plan. From this drop-down, select the default patient care plan to use while working with encounters. Note, the patient visit summary format is configured for meaningful use practices. Encounter display. In the patient's chart, you can display the data on the Encounter tab in text form or in discrete data. This drop-down allows you to set a preference. You can also choose to let the system decide if you use a variety of encounter recording tools. Rename encounter report sections. This allows you to rename these sections for the purpose of printing encounter reports. This does not relabel the fields in your system or in the encounter itself, only in reports generated from your patient encounters. Subjective. When you add a symptom to an encounter in the subjective portion, the system can either automatically assign that symptom to a category for you. You can elect to manually assign each symptom you add, or have the system always assign the symptom to the chief complaint category for you. Any of these defaults can be overridden as necessary. Review a system, just the same. Automatically assign or manually assign. And the same with objective. Automatically assign or manually assign, or automatically assign to a general exam. Add reason for encounter to the patient's symptoms. When creating a new encounter, you can add symptoms for the reason on the encounter window. And if you would like the system to add that symptom from this field to the encounter automatically, then place a check mark in this box. Add problem reviewed to bill. Place a check mark in this box to indicate that when you review a problem in the patient's chart, you want that review to gain credit towards E&M coding. However, the problem may not be related to today's visit. Remove the check mark from this option to prevent any assessments on the Review of Problems tab in the encounter from appearing on the bill. Add problem reviewed to bill. Checking this box will allow the system to add any problems reviewed to the bill for the patient. Keep in mind that the physician may not have rendered care on these problems, so you will need to be clear on how your practice wants to proceed with the review of other problems. Nurse to use provider's common list. Place a check mark in this field to use the common list of the provider. This option is for users who create pre-encounters and want to view the common list of the provider rather than their own common list while they work in an encounter for that provider. Default resources to perform plan items. This allows you to have a specific user in your practice who always performs labs or one that always administers immunizations. You can set that user as a default resource when you prescribe that type of plan for a patient in an encounter. You can change this on a case-by-case basis if needed. Each user will have the ability to set their own default resources in these areas: nursing, referrals, labs, and immunizations. Moving to chart preferences. Chart preferences allows a user to have the ability to customize certain areas of the chart to make it more efficient for them to use. Open Chart To. This allows a user to select the most convenient or useful tab in which to open a chart when they first access a patient chart. Most commonly, your registration staff will want the demographic tab, or your clinical staff will want the medical information or the summary tab. Patient Overview Dashboard. To set a default dashboard template to display when opening patient charts, you can use the lookup icon here and select the proper template in the Load Dashboard Template window. Patient Monitor. Again, you can use the lookup icon to set a template that would be most useful to your practice. Remember, each of these areas do allow you to create custom templates. In the bottom section of the window, the chartboard panes allow you to display up to 10 quick links on the blue chartboard of the Demographics tab. Simply use the arrows to move choices back and forth to display the appropriate items. You have a max of 10 that can be selected, and anything in this list will be displayed on the chartboard when you open the patient's demographic tab in their chart. Chart summary options. You have several options when viewing the summary and expanded summary views of a patient's chart. You can choose to include pre-encounters or revised encounters in the encounter filter, as well as choose a default number of months to view summary information by making the proper selection. That's noted in the When Opening the Chart Summary, display activities for the past blank months. When you're in the chart, you will have the ability to modify this on the fly. The system will always default to your settings here in your user preference. Medical information. When you review a patient's chart, there may be certain areas you always review when you first open the Medical Information tab of the patient's chart. Perhaps you familiarize yourself with the patient's history, their allergies and medications, and then move on to their current test results. Each physician has a different workflow of their review. You can set this common list and other preferences in the medical information category in your user preferences for efficiency. You can also change this information from the chart navigator. We will look at that in another video. One thing to note is you have the ability to set your auto review on medical information and indicate how long you want the system to give you before it automatically notes that you have reviewed a particular area of a patient chart. This is a good setting to configure for all users. Reroute items. MicroMD provides you with the ability to reroute any reminders or lab results to other EMR users in the event that you are not available for an extended period of time. You can also set the system to automatically copy all lab results to the users you specify at any time. Toolbars. The system allows you to customize your desktop tools and your chart tools here in the user preferences. Simply select the toolbar you want to edit and then use the available and selected boxes to move items in and out of your viewing area. Remember, the center buttons allow you to select or deselect from your selected list, and the up and down arrows allow you to move the positioning of any particular item up or down. Order types. When you're in an encounter, if you're having difficulty seeing particular areas, for example, for this user, if when they were in the Plan tab, they could not see the measures, simply come in and select View. The system will automatically configure this based on security settings. However, you do have some override options, and you should come in and view this tab. Anytime a user says, John has the ability to see the measures, but I do not, this is the place you'll want to come. Tools, User Preferences, Order Types, and make sure that either under the Visit Test section or tab or the Plan tab that you have it set to view or display on your particular user profile. At any time you want to turn something off because you're not utilizing it, for example, the doctor does not want to see nursing orders, you could simply click Hide. Maybe those are not in use for your practice. Quality Measures allows each user to configure items to track during their patient encounters. Keep in mind, pulling over all items will cause network delays and increase the load time of each encounter. You only want to pull over measures that your user profile is supposed to be documenting and tracking. For example, the front desk would be tracking demographics where a physician would not. So we would want to see the demographics for a user that was assigned a front desk role. However, a physician should be accessing things like the medication list or certain screenings, etc. During the implementation process, we will assist you in how to select your measures so that you're utilizing the system efficiently while not slowing yourself down. And finally, the Miscellaneous tab. Miscellaneous category provides an area where you can specify additional preferences for areas throughout the EMR. Latest news. From the Encounter ribbon, you can access the internet for the latest information on an item within a patient's encounter. From the latest news drop-down, select the website that you want to use for the search. For example, if you wanted to search the internet for a particular condition because you remembered hearing a news story on it, you might search Reuters' website. Select the default search engine for general internet searches while in the Encounter. Orders section. If you would like the system to print a hard copy of a lab order, procedure order, or referral order when you save it, click Yes from this drop-down. Once you save an order request, the system prompts you if you want to print the item. If you do not want this prompt, say No in your user preferences. Most common practices set this item to No. Text editor. There is a zoom tool available in the text editors throughout the system. This tool allows you to set a default value for the zoom tool. Refresh rates. Appointment Book Desktop and pop-up notifications all have default refresh rates set. It is a good idea to leave these settings as they are configured. Changing these and making them too low could cause network issues. Health maintenance. You can have the system refresh health maintenance manually or have it refresh automatically. The recommendation is that all users should set this to manual with the exception of physicians and nurses. MicroMD DMS. This user preference allows you to set which view you see anytime you open the MicroMD DMS. You can choose to open in the folder list view, or you can choose to open directly to the document search window. The standard and most common view is the folder view. Next, we can look at File and Specialty Setup Wizard. You'll notice that we have one of 4 steps in this process. You can utilize the drop-down menu to select the appropriate specialty. Once we've selected our specialty and hit Next, you'll notice that it goes into our User Preferences window, the same exact settings that we configured in the earlier portion of this video. So if you're a practice that has the need to configure a specialty that exists in this listing, cardiology, dermatology, family practice, gastroenterology, internal medicine, nephrology, neurology, obstetrics, orthopedics, otolaryngology, pediatrics, pulmonary, or urology, it is probably best to come into the Specialty Setup Wizard to perform these steps. What happens is the system will pull components it knows to be utilized in ENT practice or appropriate specialty. Next, I could go through and set each of my user preference categories, and I would hit my Next button at the bottom, and it would go straight into allowing me to see or copy common lists into my profile, so that a lot of the components that I'm looking for when I go into encounters already exist under my common list, saving me time from having to click on my all and bring them in manually one by one. And finally, step 4 of 4 allows me to determine clinic guides, dashboards, etc. The recommendation for this process would be to initially start out by going to Tools and User Preferences when you first log in the system and setting some default values. Once you've been on the system for a couple of weeks, it's probably a good idea to go ahead and go to our File menu and then go into our Specialty Setup Wizard. It will carry over the user preferences that you've already performed, but it will allow you to build your lists and other defaults much more quickly. Additionally, you can come in and you can create some of these defaults by going to your Common List Builder, and that will assist you in setting more defaults outside of the wizard. This concludes our training for the user preferences and the setup wizard.